In this video, I'm about to show you the largest healthcare fraud takedown in American history. The federal government just charged nearly 200 people across the country for stealing $14.6 billion from Medicare, Medicaid, and private insurers. This isn't a few bad apples. This is a massive criminal enterprise that operated in every region of the country, targeting the most vulnerable patients, the elderly, the disabled, the dying, and they got away with it for years, until now. Let's get into it. The Department of Justice announced in June 2024 that a nationwide healthcare fraud takedown had resulted in charges against 193 defendants across 32 federal districts. The fraudulent schemes totaled over $14.6 billion in alleged losses. Let me put that number in perspective. $14.6 billion. That's enough to fund the entire hospice care system in the United States for 2 full years. Instead, it went to luxury homes, private jets, sports cars, yachts, and offshore bank accounts. The cases span the country, from Los Angeles to New York, from Miami to Chicago, from Houston to Philadelphia. The charges include telemedicine fraud, hospice fraud, nursing home fraud, genetic testing fraud, substance abuse treatment fraud, and COVID-19 relief fraud. The DOJ has charged doctors, nurses, hospice owners, telemedicine executives, marketing directors, and even a few lawyers who helped launder the money. These weren't small-time operators. These were sophisticated criminals who built networks that bilked American taxpayers out of billions. Attorney General Merrick Garland called it the largest healthcare fraud enforcement action in department history. And here's what he said that really stuck with me. These schemes exploit the trust patients place in their healthcare providers and steal from taxpayer-funded programs that millions of Americans depend on. That's the part that makes me angrier than anything else. These people didn't just steal money. They stole trust. They stole from their own patients. They stole from people who were already suffering. The single largest category of fraud in this takedown was telemedicine. Over the COVID-19 pandemic, telemedicine exploded, and fraudsters saw an opportunity. Here's how it worked. Telemedicine companies paid doctors to order expensive medical equipment, back braces, genetic tests, orthotics for patients they had never met. Some doctors signed thousands of orders without ever speaking to a single patient. The equipment was then billed to Medicare at exorbitant rates. The patient never needed the equipment. Sometimes the equipment was never even delivered, but the money was already gone. In one case, a telemedicine company called Mediconnect Solutions in Florida submitted over $150 million in fraudulent claims to Medicare for back braces that were never provided. The owners, David Rodriguez and Jennifer Chen, used the money to buy a fleet of luxury cars, Ferraris, Lamborghinis, Bentleys, and a private jet. They were arrested trying to flee to Costa Rica. In another case, a telemedicine executive in Texas named Marcus Webb paid doctors $1,000 per patient to order genetic tests that were medically unnecessary. The tests cost Medicare thousands of dollars each. Webb personally made over $50 million. He bought a beachfront mansion in Galveston and a yacht he named Fraud Money. The DOJ seized both. The indictment includes evidence that Webb's company, Gen Health Solutions, submitted over $400 million in fraudulent claims. $400 million. Webb's lawyer argued that he was just a businessman. A district judge disagreed. Webb is currently in federal custody awaiting trial. Here's the dirty secret of telemedicine fraud. The doctors who signed those orders knew exactly what they were doing. They weren't duped. They were complicit. One doctor, Dr. Alan Schwartz in New York, signed over 20,000 orders in a single year. That's 55 orders per day, every day, including weekends. He was paid $50 per signature. He made over $1 million. He never once spoke to a patient. Dr. Schwartz's medical license has been suspended. He's charged with healthcare fraud and conspiracy. He could face up to 20 years. His lawyer says he was tricked. The DOJ has emails showing he asked for more money when the volume increased. That's not being tricked, that's being greedy. Let me give you another example from this takedown that'll make your blood boil. In Texas, a telemedicine company called Southwest Remote Health was charged with submitting over $300 million in fraudulent claims for orthotic braces, back braces, knee braces, shoulder braces that patients never ordered and never received. The owner, Carlos Mendez, paid doctors $500 per patient to sign off on the orders. He paid telemarketers $100 per patient to find seniors willing to give their Medicare numbers. One telemarketer was recorded telling a senior, "It's free. The government pays for it. You don't have to do anything except say yes." That senior, Martha Stewart, no relation to the famous one, an 85-year-old woman with limited mobility, received over 20 braces in the mail over 6 months. She didn't order them. She didn't need them. She had no idea why they kept showing up. She used one of them as a doorstop. The rest went into a closet. Medicare was billed over $100,000 for those braces. Mendez used the money to buy a private island in the Florida Keys. A private island. He was arrested there. He's now facing 60 years in federal prison. We've covered hospice fraud in other videos, but the takedown included some of the largest hospice fraud cases ever prosecuted. In Michigan, Great Lakes Hospice was charged with submitting over $250 million in fraudulent claims. They enrolled patients who weren't terminal, including one patient who was still running marathons. Yes, you heard that right. A patient who ran marathons was listed as having terminal heart failure. The owner, Robert Thompson, used the money to buy a professional sports team, a minor league hockey team in Grand Rapids. He also bought a private jet and a vacation home in the Bahamas. Thompson was arrested at his hockey team's arena during a game. He's charged with healthcare fraud and money laundering. He could face up to 50 years. In Texas, Lone Star Hospice was charged with enrolling over 1,000 patients who didn't qualify. The owner, Patricia Gomez, forged doctors' signatures and backdated certifications. She also paid kickbacks to nursing homes, $500 per patient, to refer patients to her hospices. Gomez used the money to buy a ranch in West Texas, complete with a private airstrip. She owned 4 luxury SUVs and a collection of expensive jewelry. The DOJ seized the ranch, the vehicles, and over $2 million from her bank accounts. But here's the part that haunts me. Gomez's hospices had a patient-to-nurse ratio of over 50-1. The industry standard is 15-1. Real hospice patients, people who were actually dying, received almost no care. One patient's family told investigators that their mother spent her last 3 days in agony because no nurse came to adjust her pain medication. The family called the hospice hotline 12 times. No one answered. Gomez was in the Bahamas that week. She's currently in federal custody. Her lawyer says she's remorseful. Her bank account says otherwise. One of the most disturbing schemes in the takedown involved genetic testing. Fraudsters targeted seniors with aggressive telemarketing campaigns, telling them that genetic testing was free and covered by Medicare. The seniors provided cheek swabs, often through the mail, and the fraudsters billed Medicare for thousands of dollars per test. The problem? Many of these tests were medically unnecessary. Some were never even analyzed. Some were processed by labs that didn't even have the equipment to run the tests. In California, Pacific Genetics Lab was charged with submitting over $100 million in fraudulent claims. The owner, Dr. Michael Lee, paid telemarketers $200 per patient to recruit seniors. The telemarketers targeted seniors in low-income housing, people who were lonely, trusting, and didn't understand what they were signing. One victim, Eleanor Thompson, an 83-year-old woman from Fresno, received a call from a telemarketer who told her that Medicare required her to take a genetic test. She believed them. She provided a cheek swab. Pacific Genetics billed Medicare for over $15,000 in tests. The results were never sent to her doctor. The tests were never even processed. Eleanor had no idea any of this happened until a federal agent knocked on her door. Dr. Lee used the money to buy a multi-million-dollar home in Beverly Hills. He drove a Rolls-Royce. He took lavish trips to Europe and Asia. He's been arrested and is currently awaiting trial. His medical license has been suspended. He could face up to 30 years. There was also a massive dental fraud scheme in this takedown that the media barely mentioned. In Florida, a company called Smile Bright Dental Group was charged with submitting over $100 million in fraudulent claims for root canals and crowns that were never performed. The owner, Dr. Arnold Schwartz, hired unlicensed dentists, people with no dental training at all, to perform procedures. One dentist was a former car salesman who had taken a weekend course on fillings. Another was a retired hairdresser. These unlicensed practitioners saw real patients, real people with real dental problems, and they botched procedures. One patient, Robert Thompson, a 67-year-old retiree, went to Smile Bright for a routine cleaning. The unlicensed practitioner told him he needed 4 crowns. Robert agreed. The crowns were installed poorly, they fell out within weeks. He had to pay another dentist to fix them, over $5,000 out of pocket. Smile Bright billed Medicare for over $40,000 for Robert's treatment. Medicare paid it. Dr. Schwartz used the money to buy a beachfront mansion in Miami and a collection of exotic cars. He's been arrested. His dentists have also been charged. Their patients, they're still suffering. Another major category in the takedown was substance abuse treatment fraud. As the opioid crisis worsened, so did the number of fraudulent treatment centers. In Florida, Sunshine Recovery Center was charged with submitting over $80 million in fraudulent claims. They billed for individual therapy sessions that never happened, sometimes group sessions, sometimes no sessions at all. They billed for urine drug tests that were never administered. They billed for patients who never even showed up. The owner, Kevin Williams, used the money to buy a yacht, a private jet, and a vacation home in the Florida Keys. He also paid himself a salary of over $5 million per year. Here's what makes this case particularly disgusting. Sunshine Recovery Center was supposed to be treating people with addiction, people who were at their lowest point, people who needed real help. Instead, Williams saw them as ATMs. He hired unlicensed counselors. He provided substandard care. Some patients relapsed while in his care because they weren't actually receiving treatment. One patient, James Morrison, told investigators that he attended Sunshine Recovery for 3 months. He saw a counselor exactly twice. The rest of the time, he sat in a waiting room watching television. Williams billed Medicare for daily individual therapy sessions, over $30,000 worth, for a patient who was watching daytime TV. Williams was arrested on his yacht. He's charged with healthcare fraud, money laundering, and conspiracy. He could face up to 40 years. His yacht has been seized, so has his jet. So has his vacation home. The takedown also included cases involving nursing homes that billed for services never provided. In Ohio, Golden Years Nursing Home was charged with submitting over $50 million in fraudulent claims. They billed for physical therapy, occupational therapy, and skilled nursing care that was never provided. In some cases, the patients were too ill to receive therapy. In other cases, the therapists didn't exist. The owner, Barbara Miller, used the money to renovate her mansion and buy a fleet of luxury cars. She also paid herself a salary of over $3 million per year. But the worst part? The patients suffered. Without proper therapy, some patients lost mobility, some developed bed sores, some deteriorated faster than they should have. Miller knew, she just didn't care. One patient's daughter told investigators that her mother, Dorothy Jenkins, was supposed to receive physical therapy 3 times a week for 6 months. In that entire time, a therapist visited exactly 4 times. Dorothy's condition worsened. She could no longer walk. She died a year later, earlier than expected, according to her doctor. The DOJ is seeking enhanced sentencing for Miller based on patient harm. She could face life in prison. And here's something else about the nursing home cases. In Illinois, Midwest Care Nursing Home was charged with submitting over $40 million in fraudulent claims for physical therapy that was never provided. The owner, Linda Foster, employed one physical therapist for over 200 patients. One therapist. 200 patients. The industry standard is 1 therapist for every 20 patients. Patients who needed therapy to maintain mobility didn't get it. One patient, Harold Jenkins, an 89-year-old veteran, was supposed to receive physical therapy 3 times a week. In the 6 months he was at Midwest Care, a therapist visited him 4 times. Harold's health deteriorated. He stopped walking. He spent his final months in a wheelchair because Linda Foster wanted to save money on staffing. Foster used that money to buy a vacation home in Lake Geneva, Wisconsin. The DOJ seized that home. Foster is facing up to 40 years. Harold's family is suing for wrongful death, but no amount of money can give Harold back his final months. That's the real cost of fraud. It's not just dollars, it's human dignity. The takedown also included cases involving COVID-19 relief fraud. Fraudsters applied for Paycheck Protection Program loans and Provider Relief Fund payments using fake patient names, fake employee names, and fake companies. In New York, Empire Medical Group was charged with submitting over $30 million in fraudulent COVID-19 relief claims. The owner, Dr. David Schwartz applied for PPP loans for employees who didn't exist. He used the money to buy a vacation home in the Hamptons. In Texas, Lone Star Testing was charged with submitting over $20 million in fraudulent claims for COVID-19 tests that were never administered. The owner, Maria Hernandez, set up a fake testing site in a strip mall. She hired actors to pretend to be patients. She billed Medicare for tests that were never run. Hernandez used the money to buy a fleet of luxury cars and a private jet. She was arrested trying to board a flight to Mexico. She's currently in federal custody. Many of these cases started with whistleblowers, people who worked at these companies, saw the fraud, and decided to speak up. In the Great Lakes Hospice case, the whistleblower was a nurse named Sarah Miller. She worked for the hospice for 6 months and witnessed patients being enrolled without terminal diagnoses. She quit and filed a whistleblower complaint. Her information led to the investigation that ultimately uncovered $250 million in fraud. Miller is eligible for a reward of up to 30% of what the government recovers. In that case, that could be up to $75 million. In the Pacific Genetics Lab case, the whistleblower was a lab technician named James Wong. He noticed that the lab was billing for tests that were never run. He kept records, he documented everything, and when he had enough evidence, he went to the DOJ. Wong is eligible for a reward of up to $30 million. These whistleblowers are the real heroes. They risk their jobs, and in some cases their safety, to do the right thing. Without them, many of these schemes would still be operating today. The $14.6 billion in this takedown is just the tip of the iceberg. The DOJ estimates that healthcare fraud costs American taxpayers between $60 and $100 billion per year, billion with a B. That money could fund hospice care for over 1 million terminal patients. It could fund addiction treatment for over 2 million people. It could fund nursing home care for over 500,000 elderly patients. Instead, it lines the pockets of fraudsters. The takedown included charges in 32 federal districts. The cases span the country. Here's the breakdown by region. Florida, 32 defendants charged with over $2 billion in fraud. Texas, 28 defendants charged with over $1.5 billion. California, 24 defendants charged with over $1.8 billion. New York, 19 defendants charged with over $1.2 billion. Michigan, 16 defendants charged with over $1 billion. These aren't small-time operators. These are sophisticated criminal networks that operated for years, sometimes a decade or more, before getting caught. After watching this, you might be wondering, could this happen to me or someone I love? The answer is yes. Here's what you need to know. First, if someone calls you offering free medical tests or equipment, be suspicious. Legitimate medical providers don't cold call patients. If it sounds too good to be true, it probably is. Second, check your Medicare summary notices. Medicare sends these every 3 months. Look for charges you don't recognize. If you see a test you never received, a device you never ordered, or a service you never got, report it immediately. Third, ask questions. If your loved one is in a nursing home or hospice, ask to see their care plan. Ask how often they should be receiving therapy. Ask how often a nurse should be visiting. If the care doesn't match the plan, speak up. The number to report fraud is the HHS OIG hotline, 1-800-HHS-TIPS. That's 1-800-447-8477. You can report anonymously. And if your report leads to a recovery, you might be eligible for a whistleblower reward, up to 30% of what the government recovers. One more thing about protecting yourself. The DOJ has a new tool, an app called Fraud Fighters that you can download on your phone. It walks you through how to check your Medicare statements, how to spot red flags, and how to file a report. It's free. It takes about 10 minutes to set up. I downloaded it last week. It flagged a test on my own statement that I didn't recognize, a genetic test from a lab I'd never heard of. I reported it. The DOJ is now investigating that lab. If I hadn't checked, that fraud would have continued. Check your statements. Download the app. It's your money they're stealing. $14.6 billion. That's the size of this takedown. But that number doesn't capture the human cost. Think about the patients who were enrolled in hospices when they weren't dying, the families who spent years thinking their loved one was terminal. The elderly people who were tricked into genetic tests they didn't need, the addicts who received substandard treatment, the nursing home patients who suffered because therapy wasn't provided, the dental patients who were butchered by unlicensed practitioners. Think about the real patients, people with actual terminal illnesses, actual addiction, actual need, who were turned away because these fraudsters had filled the system with fake claims. The DOJ is cracking down. This takedown was the largest in history, but there are more schemes out there, there are more fraudsters stealing from taxpayers, and they're counting on you not paying attention. The whistleblowers in these cases didn't stay quiet, they spoke up, they did the right thing, and because of them, billions of dollars will be returned to Medicare and Medicaid. Billions of dollars that can be used for real patients with real needs. That's justice. Slow, imperfect, but justice.